Hey everyone, in this lecture we will discuss the human vertebrae. The human vertebrae is also known in layman's terms as the backbone. It's a central bony frame upon which several muscles and organs are built. There are several different types of vertebrae in the body. There are cervical vertebrae in the neck, thoracic vertebrae in the chest, lumbar vertebrae in the lower back, and sacral vertebrae in the pelvic region. In addition, there is also a coccygeal vertebrae, which is a vestigial structure. Every vertebrae consists of a body, a pedicle, lamina, transverse process, spinous process, and intervertebral disc, as shown in the image. Vertically, there are outpouchings of bone called articular facets, which prevent the spine from undergoing hyperflexion or hyperextension. In the middle of each vertebrae is a hole called the vertebral foramen. The spinal cord, which is an extension of the brain, goes through the vertebral foramen. There are 7 cervical vertebrae present in the neck region. They are named C1 through C7 respectively. The bone of each cervical vertebrae is much smaller and a spinous process is split at the tip. For this reason, the spinous process is known as a bifid spinous process. Having a bifid spinous process gives the cervical vertebrae an additional location for muscular attachment points, making the neck more flexible than the rest of the vertebrae. C1 and C2 are unique. C1 is known as the atlas, and C2 is called the axis. Between C1 and the occipital bone of the head is a joint called the atlanto-occipital joint. This joint permits flexion and extension of the head. Rotation of the head from side to side is permitted by the joint between C1 and C2. The axis contains a small bone, which is called the dens, as you can see in the image, which fits inside the atlas, allowing this rotation to occur from side to side. There are 12 thoracic vertebrae, named T1 through T12, as you can see in the image. Each one has an attachment to a rib. The ribs are named C1 through C12, corresponding with the level of thoracic vertebrae that they attach to. Similar to the cervical vertebrae, thoracic vertebrae have nearly identical features. However, the spinous process in the thoracic vertebrae is not bifid, and the body is much larger. Having a larger body helps distribute the weight of the body that it supports. The lumbar vertebrae is somewhat different than the other examples of vertebrae that we've seen. The body of the lumbar vertebrae is much bigger, allowing the lumbar vertebrae to support much more weight. Also, by comparison, the articular process is somewhat thicker, and the spinous process is smaller. These unique features make the lumbar vertebrae and the intervertebral discs between them more susceptible to stress injuries. The sacrum and coccyx are the final 2 portions of the backbone. The sacrum is a fusion of 2 large bony pieces, making one large triangular vertebrae which is not flexible. The sacrum serves as the supporting posterior wall of the pelvis. The sacrum has 8 holes which run vertically, which are called the sacral foramina, and they serve as passageways through which nerves and blood vessels are able to run. Below the sacrum are 2 small fused bones, known as the coccyx. These bones are vestigial structures which are evolutionary remnants of tails. They play a small role in the digestive process by moving slightly with the aid of the pubococcygeus muscle, allowing the bowels to straighten and empty.